Thank you so much for having me here today. I appreciate the topic. It's supporting seniors' well-being, and we're going to talk today about in the community as well as in long-term care, which is where I'm quite involved at the moment. So we're going to begin with what social isolation is, and then talk about some community projects that, under the auspices of New Horizons, that were carried out across the country that facilitate social inclusion. And then talk about social inclusion, social isolation, and COVID. And finally, about the project I'm working on today, which is action to reform action to reform residential care. And this one is, when we get there, we'll be talking about COVID, social isolation, and long-term care. Okay, could I have the next slide, please? So the formal definition of social isolation really is that we have fewer relationships than we need to feel connected. You can have a lot of relationships, but if they don't make you feel connected and they're not rewarding, that's not enough. Less contact and others than we need. For example, it may not be a deep relationship, but the fact that in my own community I go to stores where I recognize people is a positive thing for me. Contacts and relationships that are mutually satisfying, because you can have toxic relationships or relationships that you just tolerate. That's not going to contribute to feeling good. It is a subjective thing though. Some people are loners, some people prefer to be by themselves. I don't think anybody wants solitary confinement, but it is a question of whether you're more or less extroverted, what kind of coping strategies do you usually use, and how many people you need for that. Various things like that, and it changes over time as well. The sense of whether that loneliness that you sometimes experience turns into social isolation. It can happen to anybody, and it changes over the life course as circumstances change in our lives. The kind of things that put us at risk formally are things like living alone, being age 80 or older, having no children, or little contact with family. Sometimes that's for geographic reasons. Right now, it's to do with COVID. If you're living with a low income, that reduces the resources available to you. Having poor health or multiple health, chronic health problems, that can reduce energy and limit your access to resources again, or opportunities. And then critical life transitions like retirement, death of a spouse, losing your driver's license, all those things can happen to any one of us today. Some of those things we can't change, and some of those things we can. But as we age, a diminished social network usually happens because of the losses and various other things. And also caregiving is a significant factor as well. Can I have next slide, please? Yeah. Why does it matter? And this is why there's been a lot of money put in at the federal level over the past number of years looking at social isolation and ways to reduce it through social inclusion. And the reason for this is because seniors are huge in terms of the volunteer sector and in the paid economy. And certainly right now during COVID, lots of people that would volunteer aren't volunteering, and that's going to become quite apparent to agencies. Communities suffer from a lack of social unity. And there's higher social costs when you don't have social unity. They knit the communities together, especially in rural areas. There are areas where there's high proportions of seniors. The loss of experience and wisdom and history that seniors bring to our families and our communities also is lost when you have people who are socially isolated and not able to participate. And on an individual level, there's significant health impacts as a result of being socially isolated. There's an increased chance of premature death, poor general health, more disability from chronic diseases, caregiver burden, a reduced sense of well-being, more depression, reduced quality of life, poor emotional and mental health. Those are all the personal consequences of social isolation. Next slide, please. Could I have the next slide? Next slide. I hope you can still hear me. Okay, many factors are beyond the individual control in terms of social isolation, and this has been recognized by different levels of government, that some things are actually going to take social, economic, or political change. and a multifactorial approach in order to address social isolation and increase social inclusion. That was the purpose of having the New Horizons Pan-Canadian projects, of which there were 13 over a 3-year period in Canada. It takes a multifactorial approach and involves many strategies and organizations to address social isolation at the community and the system level, even at the individual level. So one of the things I will talk about are some of the projects that were implemented during these Pan-Canadian projects that are still ongoing. Some of them are and some of them aren't. But just thinking about the multifactorial aspect of things and how so many aspects of what might socially isolate a person are beyond their individual control. Just think about transportation. You know, if there isn't adequate transportation, suitable transportation for your particular needs, which could take into account disability, but could also take into account location. You know, that where you are geographically located, the availability of a bus, for example, in a rural area, or even in an area like Nanaimo, where I live, where you have to walk a long way to get to a bus stop from many parts of town. That means you're not going to be able to get out to things, particularly if you've lost your driver's license or the person who drove you if you weren't the driver. You know, those kinds of things are systems issues that need to be addressed. They're not all personal. Things like, in terms of getting around as well, and people have talked a lot about this, is bathrooms, the availability of bathrooms, knowing where a bathroom is when you go out. That can limit a lot of people who have issues around incontinence or are fearful of incontinence. The other kind of thing is affordability as well. If you're not on a bus route that's easily accessible to you, or on top of, you know, not on top of a steep hill in Nanaimo, for example, then also the affordability of a taxi cab becomes a real issue for many people who have low income. Finally, getting information is another thing that requires a systems approach. That's things like technology. Who doesn't have Zoom today or some such thing? Lots of people, you know, FaceTime. Many people don't have the resources or don't know how to use the resources that enable them to hook up with other people remotely, which is really important in this time. The cost, you know, don't underestimate the cost of things associated with technology as well. And then there's issues like literacy and language. Getting access to services is another barrier to social inclusion. And that's like finding the services. That's really hard. Those awful voicemails that you get where you have to go through 10 choices to get what you want. That's been identified as a real barrier by seniors. Finding services through, you know, then there's wait lists. Services are capped. The services are too little or too late to support your participation socially in the community, and things go downhill. Affordability is another thing that can create social isolation or contribute to it. You may, on a low income, you may have to choose between your medications, a hearing aid, your glasses, or joining the local gym, actually through the city, which is quite reasonable, but all those things add up on a low income. Finally, health, the kind of things around your own health, that's not just mobility, but it's things like energy limitations. And then the suitability of programming for seniors as well, thinking about long-term care in particular. There's what kind of programming is offered, how much of it's offered, how accessible that is, what times are offered. Men's programs are lacking greatly, culturally appropriate programs are lacking, the location of programs may be out of reach. So those are many of the factors that the New Horizons Pan-Canadian projects asked the projects to look at in terms of increasing seniors' inclusion in their communities. So we had a project here in Nanaimo, and like all the projects, we're supposed to increase the number of seniors who have support and help when they need it, participate regularly in activities, or feel connected to and valued by family, friends, and acquaintances. So we took a number of approaches to that. There were some individual programs like peer-to-peer programs that were developed that were culturally appropriate for different populations. And there were also community programs that were developed. Can I have the next slide, please? And systems-based ones as well. Yeah. In terms of the kinds of, I guess the kinds of things we did, intergenerational connections. There were a lot of, and this is not just Nanaimo, but a lot of intergenerational connection programs For instance, here we did a paper pal program which linked children in grades 3 and 4 with seniors in long-term carers or seniors in the community, and it was a pen pal idea that was literacy for the children, creating connection between the generations, and also ended with a tea where people came face to face and met the person that they had been communicating with. That was a very cool program, and it's operating in Victoria right now, without the tea, of course, but certainly with the letter writing. We had somebody in one province made for teenagers, the Seniors Are Cool video in French and in English, which is online. And that was to sort of to reframe seniors for younger people. Anti-ageism, that was also an anti-ageism project, really. But we also did other things around anti-ageism. We created a toolkit for organizations about how to identify ageism and how to address ageism and avoid ageism in their own organizations. The other kind of thing that was done was an education and awareness through the arts around ageism in Quebec was very successful. Ageism is a big issue because although there are no typical older people, society often views older people in stereotypical ways. That can lead to discrimination against individuals or groups simply because of age. You've heard, likely during COVID, the idea that those old people were just going to die anyway. And at one point, there was a saying going around about, I forget exactly how it goes, but basically the virus was, it really meant the virus wasn't a bad thing in terms of older adults, right? And I guess the other thing about ageism that we really have to be aware of is that when they're framed as dependent or a burden, older people are viewed a certain way when it comes to policy making. How much are we going to spend on older people if they're devalued? How much emphasis do we place on cost containment in our policies more than on our on care, for example? One of the things we did was had a health committee that looked at policies from the perspective of ageism and provided also an education program in Alberta for healthcare providers around ageism in acute care. Increasing access to information was huge for all the projects, and that meant that there were paper products, because that was often the most preferred, paper products, but in different languages, for example, around services. Also for information about the signs of social isolation. One of the things we did for facilitating community connections was to develop a champion training program, which was taken up by COSCO, which is the Canadian Organization of Seniors Organizations, I believe is the full term. They took it up and are using it as one of the national workshops. And that project was to have citizens educated in signs and symptoms of social isolation and also of the impact of social isolation on people, and be able to go out and become advocates for seniors, and also to identify seniors in the community and take certain actions. And those that were really socially isolated in a serious sort of way were referred to the crisis care people. That was a good one. The other one that I'm thinking about in Vancouver, they had an ambassadors program, which I doubt very much is operating right now, but they were trained seniors who went around into public places and parks, and when they saw somebody sitting by themselves, somebody who looked lonely, they'd sit down, talk to them, and actually take them to possibly take them to a program, a seniors program that was scheduled ahead, perhaps on another day, once they found out their interest. They also just went around in public places and handed out brochures in different languages and about different area activities. Facilitating community connections, I think that would work. That certainly was very powerful in Vancouver, they found, for being able to get more people into their programs and socially connected. Facilitating leadership, all the projects were senior driven to varying degrees, and all the materials were vetted by seniors. And we're also in one project, seniors were trained as speakers in talking about social isolation, social inclusion, and also about ageism. That was useful, I think, in terms of making people educating the public more about it. Here in Nanaimo, we did a play. Actually, we had commissioned and put a play on that was well received and is now on the internet. That was about multi-generational connection and social isolation, social inclusion. And finally, there was the one other thing I'll mention through the arts that was done was a photo voice project, and public galleries showed this photo voice project of where seniors took pictures, seniors who identified as feeling socially isolated or lonely, took pictures around the communities and then captioned them. And then those pictures were shown in terms of their impact on how they felt inclusive or not inclusively involved in their communities. Next slide, please. Okay, all those programs that I mentioned all had a bearing. Some were systems, and I should mention transportation. There were a lot of ways to address transportation problems too. But all of those programs depended on face-to-face contact by and large. We have some things now that are online. We made a repository for many of the programs online, and I'll give you that website at the end, so that those remain in existence. But most things were done face-to-face, and of course with social isolation and COVID, that's been a problem in terms of maintaining these programs. Social distancing is actually counter to what we do usually as humans when we feel threatened, and that many people feel threatened by COVID, and yet they're supposed to stay away from other people. As I mentioned earlier, not everybody has the technology to reach out to other people for support or to provide support, FaceTime, for example, or Zoom, but many people have a telephone. On the other hand, a lot of the people who are having to stay at home, who live alone, who are older, may not have a wide network of people that they can telephone and talk to. Forced social isolation, fear for health in the future leads to chronic stress with negative impacts on mental, emotional health for many, and there's research on that now. And I mean, forced social isolation is being in your singular bubble without having somebody else that you can talk to or actually see face to face. Thinking about long-term care, many of those people haven't seen a family member for months and months and months, never mind a friend. You know, so all this has negative impacts on how people are feeling. The usual strategies to increase connectedness may be unavailable. For example, you can't just join a group right now. I belong to an exercise class, but they're gone. You know, you can do it on Zoom, and I have Zoom, so that's not so bad. But many people don't and wouldn't use the technology if they did. The kinds of things that face-to-face things, joining groups, you know, it's just not in the cards at the moment. Even going grocery shopping, which might have been a social occasion for a relatively isolated person, isn't really that available right now, especially if you have chronic health issues. So reduced social connection and reduced participation is absolutely hand in hand with COVID. And there's a lot of information coming out now on how that affects people, and it's not good. Next one. Could I have the next? Okay. So everybody's risk is increased. I think the other thing that's happened with COVID is the shocking information that came out from Ontario in particular, but not only Ontario, about issues in long-term care facilities. You know, that has really been, I think, added to people's stress, older people's stress who have health issues and maybe are facing the idea that someday they might need those kind of supports. The other thing too with COVID is the availability of home support workers, continuity of care, very challenging in a COVID situation for people that were receiving those or other services at home. It's forced us to adapt and adjust to a new normal, and we're not there yet. And I think as well, some of us don't have, as I said, the same abilities that we had previously to adapt. We don't have the same, and that could be just because of COVID. You can't get out and use people like you used to, or be with people, but also the health changes and so forth can have happened in this period of time that limit the loss of a driver's license, all kinds of things in a almost a year. We're getting up to a year. The need to manage stress and to cultivate positive mental health and emotional health has never been greater than it is now. Many people feel anxious or depressed by being forced to stay at home. And I'm not talking just about seniors now, I'm talking about many people who live alone are feeling anxious and stressed by isolation and also by financial factors that may be impacting on them. Not being able to see grandchildren, all those kinds of things. So one of the things we need to do, that all of us, is we need to develop new ways to connect and to remain positive as much as we can, because this isn't over yet. Next slide. So here's just some ideas for the community. You know, learning the technology, and if you have a computer, there are things online that teach you to use Zoom and this platform that we're using right now. Some of it's free. Some of it enables you to have, you know, multiple, like I had a book club on Zoom last night, a book club meeting, for example. Once people have Zoom or some such thing, you can have group get-togethers, you know, just as you did. There's a cooking group I notice on Zoom that some people have where they're all in their kitchens following the same recipe. You know, a little creativity, and with the technology. Certainly learning FaceTime if you have an iPhone, but not everybody does, is also a really important way to connect. One of the things in these pan-Canadian projects we did was try to teach people how to use technology. There are places where you can learn that through the libraries, for example. Here in Nanaimo, you can call up and they'll walk you through setting up Zoom and being able to use it. So there are some resources in some communities for that. Signing up for a course online, it's an opportunity. We've got lots of time. There's digital ones, there's university ones, there's language courses. And I came across a website called Go Boomerang, which has, some are free, some you pay a little bit of money for, but creative workshops, learning new skills workshops, also well-being workshops, and sort of a community forum as well that looks really interesting. So there are things, if you have access and are able to use online tools, there are things out there. Volunteers, if you want to volunteer, if you need a volunteer, the 211 number is the one to call. That can be very useful. They can set you up with a telephone buddy, as likely can your local volunteer organization here. They are setting people up who want a phone buddy. Building a skill, of course, there's opportunities again. You can play bridge online if you want to. Again, it's online. So many things are online, and I think that's one of the biggest messages for me, who doesn't have the technology to show my picture or to show myself on this this webinar that we're doing, is if you have to learn the technology. It's the same, it's as important as using a telephone these days. And if you can't afford the technology, it's available in the libraries for free, though there's the issues of masks and so forth right now. But going forward, if you have the capacity and the means, it's a really important skill to build. Other skills that one can build, you know, let your imagination run wild, really. As I say, there's cooking programs, language programs, all kinds of things. And finally, you can even do exercise programs, which I have done and actually works out quite well. And there's programs for yoga, for mindfulness, all kinds of things online. Support groups that you can find through, again, online. But there are also, I believe, through the BC Family Caregivers, or sorry, it's Family Caregivers of British Columbia, there is a, they can match you up in a group to talk about, just to socialize, really. Okay, next slide. So finally, social isolation and long-term care. Right now, of course, staff are the most significant contact, because many people haven't got visitors, frequent visitors at the best of times, and those that do don't necessarily have family coming in to see them now because of the various rules that are primarily set by each facility in terms of who they can, how they can manage people coming in, how well they can protect people that are in the facility from COVID. There's system issues that make relational care difficult. Of course, we know that, and that's short staffing. That's when you don't have continuity of care. And that is, again, accentuated right now to some extent because people, especially in some facilities, are rather short-staffed. At the same time, the one-site rule means that there are more of the same people in the same facility than previously. Lockdown and quarantining has certainly increased isolation. As I say, there's a huge movement by families who are trying to become essential visitors or even social visitors. And the Bonnie Henry's edict is interpreted by each facility. So some people haven't seen their family members for months upon months. Not everybody can use FaceTime, which is the alternative, or even telephone calls, especially when there's dementia. That can become problematic. The impact on residents' well-being and mental health and on families too is certainly real and has been looked at in various research projects and also ongoing research projects. And just today, a position paper came out from the Canadian Academy of Geriatric Psychiatry and Canadian Coalition for Seniors Mental Health that looks at the impact, looks at the need for mental health services during COVID and onwards, and the impact on residents, staff, and family. The uneven application of visiting rules I just mentioned, and then finally, you know, everything that we've seen as a result of COVID is really just an exacerbation of systems problems, the staffing, the mix of staffing, the focus, the model of care that have just been exacerbated. Can I have the next slide, please? So what we did, Action for Reform of Residential Care, as a voluntary, nonpartisan citizens group made up of researchers, clinicians who do or have worked in long-term care, families, and seniors. And we created a report for the government that we intend to support them in moving forward in long-term care. We didn't focus on COVID. Instead, what we focused on were the systemic issues that everybody knows are long-standing in relation to the workforce, in relation to the model of care. We want to see a move to person-centered relational care that puts quality life right at the center, and human rights as well. We want to see a well-supported and adequate number of staff, quality of life that is the focus, quality of care. We were shocked when we went through the monitoring process and also went back and looked at the process that led to the 4 retirement concept facilities being put under administration in BC, at the inadequacy of monitoring and the ability to enforce the quality of care and life. We created quality of life standards that we hope will be adopted. We mandated family councils, or asked the government to mandate family councils to give families a voice, and also to eliminate profit making at the cost to seniors and staff. Those essentially are the key points that we made with the ministry. And we did have a meeting with Mabel Elmore, who is the Parliamentary Secretary for Seniors and Long-Term Care, on January 12th, where we asked her to strike a task force to take action on our recommendations, a multi-stakeholder task force. We have huge support from labor, from professional organizations, from key influencers for the report, for the recommendations the report made, that we are going to be building on, because we do believe that that is what enabled us to have that meeting with Mabel Elmore, and that hopefully will come to fruition of some sort. So that is all that I want to say about that, except the next slide. So most of you, everybody likely is in communities, so I've shared some ideas about what people can do who are socially isolated in the community to improve their well-being. If you want to participate and take action in terms of long-term care, it would be great if you could share the ARC report with other people. We are sending it to all the MLAs and to the MPs from BC to become an ARC member, because the more members we have, the more support, the more credible we appear. We are credible, but the more weight that gives our recommendations. And we are going to be sending out a petition in the next week or so about national standards to the federal government that we will be circulating and will be on our website. everybody can do something to address social isolation in the community and also in long-term care, where I think people are feeling it the most right now. Thank you. The last slide has some resources on it. If you just want to put that one up. Okay. Is that the last slide? Okay. Yeah, I just put some links here, some ideas for activities while socially isolating, and tips for battling anxiety during COVID is another one. And I will send the Go Boomerang link to Mary Lou, as well as a link to something else I came across just today that might be useful to people. So thank you very much.